Hello, I'm Jeff Gold, and welcome to this Maverick Minute. My guest today is Dr. Jane Meza, and as I'm sure our audience knows, Dr. Meza is our Executive Director of the UNO Office of Health Security. And we have a number of important announcements to repeat, and of course to share some new information today. Dr. Meza, thanks so much for being with us today.
Thank you.
So let's start off with what's new and different. I understand that in a very near future, we're going to be offering a trial of a new vaccine protocol to the UNO student body. It's called Prevent COVID-U. And maybe you could tell our audience a little bit about what the trial is, how it's going to be conducted, and of course, hopefully we can get to which students would be eligible to participate.
Yes, so it's really exciting. UNO is one of 20 universities around the country that were selected to participate in the Prevent COVID-U vaccine clinical trial. And the purpose of the trial is to further study how the Moderna vaccine can prevent COVID infection. And it's a really great partnership with Children's Hospital and UNMC. We're working closely with Dr. McCullough at UNMC to offer this vaccine clinical trial to students at UNO. The trial itself is actually available now. Students can go to the preventcovidu.org website to learn more information. We also sent out an email last week to students to let them know about the availability of the clinical trial. And the way the trial works is that it's open to UNO students age 19 to 26, and students are randomized to receive the Moderna vaccine either first or after a few months. And one of the really nice things is that the students will know which arm they're on, whether they're going to get the Moderna vaccine first or whether they're going to get it after a few months. And then to participate in the trial, they would take daily nasal swabs that they can do right at home. And then they would just need to come into the UNO Scott Conference Center twice a week to get a nasal swab test through PCR. And so we're really excited about it because it's yet another opportunity for our UNO community to receive the vaccine, but it's also a way for us to help to participate in further research about COVID.
So as I understand, Dr. Meza, and hopefully our audience does as well, that the Moderna and the Pfizer vaccines both received Food and Drug Administration emergency use authorization back in December. They've been widely used across the nation very successfully to prevent COVID and very safely to prevent COVID. They're 95 and 94% effective, respectively. So this is a clinical trial, but it's not in a clinical trial in the sense of safety and efficacy of the vaccine. It's a clinical trial in the sense of the impact on college-age students and the ability to carry and transmit coronavirus. Would that be an accurate description?
That's correct, and that's why it's really important that people who participate in the trial are able to do those daily nasal swabs and come and get tested twice a week at the Scott Conference Center so we can better study the infection and the ability to the use of the vaccine for preventing infection in the college-age population.
And during the trial, either early on or later, all of the students that are enrolled will get the full dose of vaccine. Is that correct also?
That's correct. Everyone will get the vaccine. They'll either get it early when they enroll, or they'll get it after a few months, depending on which arm they're randomized to. And again, they'll know when they have their first visit, they'll know which arm they're going to be randomized to. So it's helpful to have that information right away.
So it's really good news now because over 30% of eligible Nebraskans have received at least their first dose of vaccine, and a very healthy number have received their second dose of vaccine. But let's just take a minute, Dr. Meza, and remind everybody that the vaccine is not a passport. It's not a free pass to do anything and everything that you might have wanted to do previously. And things such as using masks, social distancing, etc., gathering in groups, all very important to remember that those are critical aspects as we move forward, at least during the next several months.
Absolutely. The way we're viewing the vaccines is that we really want to encourage everyone to get a vaccine, and remember that it's one of our tools in our toolbox for preventing COVID, as you mentioned.
Well, I want to thank you again, Dr. Meza, not just for joining us today on this Maverick Minute, but for all of the things that you've done over the last year. Your influence, your judgment, your kindness has been absolutely essential to having UNO on this journey of safety and wellness, and it's what's allowing us to bring people back to campus safely, to athletic events, classrooms, teaching labs, concerts, and so many other things that make our university environment so rich and so successful.
Thank you very much. And we're working closely with the campus, with individuals, if they want to schedule a time just to talk with us, to think about what it is that they're looking to do. We work with them and help them create a plan so that we can do it safely.
Okay, we have to all remember, prevent COVID-U. I love the idea.
Thank you. Me too.
Thanks so much for being with us today, and thank you for joining us on this Maverick Minute.